to school. Question 1. Tell us about yourself.
My name is Leslie Vise, and I've been working in the mental health field for about 10 years. I started as a case manager for Texas Department of Criminal Justice, teaching classes and doing intakes with offenders for a specialized program. And then I began working for MHMR, working with children and their families. And most recently, I've been with the University of Texas Medical Branch for the past 7 years, and I work as the mental health manager for the biggest female intake facility in the state. And just at the end of last year, I was awarded Mental Health Person of the Year for the region.
Well, that's awesome.
Thank you.
Question number 2. Where do you see yourself in your career in 5 to 10 years?
In 5 to 10 years, I see myself working as a psychiatric nurse practitioner, probably working for UTMB, which is who I work for now, but in a different capacity.
Wonderful. Number 3 is a 2-part question.
Okay.
What are your strengths and what are your weaknesses?
For strengths, I would say that I'm a friendly person. I build relationships easily, both within departments and between departments. I've been able to build a relationship with our nursing team and our admin team, which has helped the culture of our workplace. And also, I think I'm a pretty calm person and able to find solutions easily, rather than focusing on problems. I tend to be quiet and think before I speak, but occasionally that can be seen as a weakness as well, because it can make me come across as maybe timid or weak, and that I could be easily manipulated or taken advantage of.
Okay. Question number 4. Talk to us about the value of teamwork. What did you do in your last job to contribute towards teamwork?
Teamwork is very important. I think it helps motivate people to do a good job, and it also helps people find solutions together versus working separately. In my last job, I helped plan the mental health training day every year, and we started implementing a team building challenge. One year we did a gingerbread house competition where everybody brought ingredients to create a gingerbread house together with their team, and to work on working together. And it was everybody really enjoyed it. It was a good thing, a good team building exercise. And then just this last year we did a puzzle activity where people had to barter for the correct puzzle pieces and work together as a team to make sure they could get all the pieces in their puzzle.
So would you say teamwork makes the dream work?
Absolutely.
Number 5. Tell me about the most difficult patient experience that you have ever had to handle, perhaps an angry or upset patient. Be specific. Tell what you did and what the outcome was.
Working in the prison environment, we get lots of difficult patients. It's pretty much a daily or weekly occurrence. The most difficult patient I can remember right now is a female offender that was in segregation, and she was in the day room, and she was beating everything, like the table, and she was hitting the table so hard that I think the bolts were coming out of the floor, and she was trying to climb the fence, and she was just yelling nonstop, cursing, and several of my coworkers had already tried to calm her down, and security had tried to calm her down. They were threatening to use force on her, which could mean spraying her with the pepper spray or cuffing her. And what they ended up doing was calling me, and I went down there and calmly talked to her, and I didn't react to her or get loud like she was, and I was able to calm her down and get her to cooperate with security so she could be escorted to her appointment.
Well, that's awesome. That's all 5 questions. Thank you for playing.
Thank you.
Bye-bye. Ta-ta now.
Bye.